Now let's open up the conversation to Q&A. We received a number of questions in advance. If your question is not answered in the following section, please submit your question by sending a private message to the Her Fate Facebook group. We'll respond as soon as we can. For the first question, how to talk to your physician, or what question should you ask your OB or your primary care physician? I would encourage you to talk to your family members prior to your visit. Ask about any family history of heart disease and be sure to share that with your physician. Also, ask your physician what are your risk factors for developing heart disease. Do you have high blood pressure? Have you had an elevated blood sugar? And ask your physician to review those with you and how you can reduce those risk factors to prevent developing heart disease. If you're having symptoms, even though you may think they're not related to cardiovascular disease, be sure to share those with your physician. Sometimes women avoid relaying symptoms because they think they're unimportant, but especially with women, because the symptoms are so atypical, any unusual symptom is important for your physician to know about. If you need a boost of confidence, bring a family member or friend with you to your appointment. It often helps to have someone else listen to the physician's responses so you can be sure to remember everything that was discussed. Okay, let's get to our next question. Our second question is, any advice on how to advocate for myself? First and foremost, I would tell you as a woman, trust your gut instincts. The bacteria that live in our GI tract are called the microbiome, and they've often been referred as the second brain. Your gut instinct is a powerful instinct, and in my career, I've never seen it fail a woman. Remember the statistics that we shared? That few physicians are even aware more women than men die every year of cardiovascular disease. So when you're relaying symptoms to a physician, if they're not listening and don't take you seriously, trust your instincts and seek a second opinion. And our third question today is, can you discuss the importance of women representation in clinical trials? Well, women are often the primary caretakers of not only children, but often aging parents, and multitask. The last thing that women want to do is sign up for another to-do endeavor. But it's so important that women are part of clinical trials. Today, most clinical trials have only a small representation of women, so we don't have the evidence we need to best treat women. We've already discussed today the signs and symptoms of heart disease in women are different, and they're often atypical. So it's critically important we have adequate representation of women in clinical trials to determine the best science to both diagnose heart disease in women as well as to treat heart disease in women. And our fourth question today, how do symptoms differ between men and women? For a heart attack, the classic symptom for a man is chest pressure, but it's rarely the case for women. Women can simply feel tired or short of breath. They may have sweating or abdominal discomfort or nausea. 10% of the time, women can have simply jaw pain. So the symptoms can be very different in a woman than a man. As far as for heart failure, the symptoms are subtle. They can be tiredness, swelling in the ankles, which often occurs especially during pregnancy, and women attribute these symptoms to either aging or overworking, not sleeping, and don't seek treatment. Okay, that wraps up our Q&A. Again, if you have any additional questions, please submit them by sending a private message to the Her Fate Facebook group. We'll respond as soon as we can.